Do you frequently feel like your heart pains sometimes? No, that's good. But what if small cuts leave you bleeding for a very long time? Or you get sudden nosebleeds when nothing feels wrong? Imagine this: you're just brushing your teeth, and your gums start bleeding and won't stop for 20 minutes. Frustrating, right? That's what life can feel like for someone with Glanzmann Thrombasthenia. It's a rare blood disorder where your blood doesn't clot properly. Think of it like having fire trucks in a city, but they can't park next to the fire because the brakes don't work. Your platelets, the tiny cells that plug wounds, are there, but they just can't stick together to stop bleeding. So even tiny injuries can become big worries. What causes this problem? Well, think of your platelets as little sticky helpers. Normally, when you get a cut, these helpers rush to the spot and grab onto each other using special glue proteins. One key glue is called glycoprotein 2b3. In Glanzmann Thrombasthenia, the body either doesn't make enough of this glue or makes a broken version. And this isn't something you catch from others, it's genetic. So, both of your parents must carry the abnormal gene for you to get it. Like getting blue eyes or curly hair, but not as fun. If both parents are silent carriers, there's a 1 in 4 chance their child will have the disease. So it runs in families like a trait, but one that affects your blood's teamwork. So how do you know if someone has it? Let's play detective. Common clues: nosebleeds that won't quit, you pinch and pinch, but blood keeps coming. Gums bleeding after brushing, even heavy periods in girls and women. Kids might have bruises pop up like surprise ink blots on their skin, without even bumping into anything. Have you ever seen someone with a small paper cut and they bled more than expected? Multiply that by 10. Some people bleed into their joints, making movement painful, like a stiff, swollen knee after no injury. And surgery, it's risky without preparation. So, any long or unexplained bleeding, especially from a young age, is a red flag to check platelet health. How do doctors find out what is going on? It is like a blood puzzle. First, they look at your history. Do you bleed a lot? Then blood tests, one called platelet aggregation test. They mix your platelets with chemicals and watch if they clump. In this disease, they just float around like lonely fish. No clumping means strong clue. Genetic testing can confirm it too. Treatment, there is no cure yet, but we can manage it. For small bleeds, special drugs like tranexamic acid, a mouthwash or pill help plug the leak. For big bleeds or surgery, you may need platelet transfusions, borrowing working platelets from donors. But here is a twist: too many transfusions can make your body fight future ones. So doctors use them wisely. The key is to stop bleeding fast and avoid injury. So no contact sports like boxing, but swimming, sure. Can we prevent the disease itself? Not yet, since it's handed down in genes. But we can prevent serious problems. Think seatbelts. You can't prevent car accidents, but you can reduce harm. Same here. Families with this condition should get genetic counseling. Parents can be tested before having kids, like checking the weather before a picnic. For patients, prevention means avoiding blood-thinning medicines like aspirin, wearing medical ID bracelets, and teaching schools or coaches what to do if bleeding happens. Regular checkups, yes. Safe lifestyle, very. Vaccinations are important too, because infections can trigger bleeding. So prevention isn't about stopping the gene, but stopping the danger. What is new in the world of Glanzmann Thrombasthenia? Good news, science is working hard. Gene therapy is being tested. Imagine fixing the broken gene in your cells so your platelets make good glue again. Early trials show promise. Patients had better clotting after treatment. Also, new drugs that mimic the missing protein are in labs, like creating fake but helpful glue. Stem cell transplants have helped some, but it is risky. Researchers are also building better platelet substitutes, artificial helpers that can plug holes. And global registries are tracking patients to learn more. It is still early, but hope is growing. Scientists are not just managing the disease anymore, they are aiming to cure it. So one day, kids with this will not worry about nosebleeds